our office manager, her daughter had endometriosis, and it can be sometimes very hard to make the diagnosis. And so we're going to look at something that may or may be involved in some of us, and what to do about it, and it's a relationship to the heart. So I'm really excited. Thanks so much. Take it away, guys or ladies.
All right, so we'll start off with what exactly is endometriosis. Go to the next slide. So a woman's uterus is lined with something called endometrial tissues, and collectively this is called the endometrium. In fact, an endometrium is formed with each menstrual cycle in preparation for fertilizing an egg. So when the endometrial tissue starts to grow outside of the uterus, a person is said to have endometriosis. Usually this growth happens in the ovaries or the fallopian tube. And this growth can lead to scar tissue and just general inflammation in the pelvic region, which is usually the cause for pain. We'll go to the next slide. So endometriosis is usually diagnosed by way of an ultrasound, in particular a transvaginal ultrasound, as well as an MRI may be used to just triple confirm whatever the clinician is looking at. And once again, they're trying to see if there's any of that endometrial tissue that is being found outside of its normal area of the uterus. Go to the next slide. So in terms of causes, currently there's no definite cause for endometriosis. However, research and researchers have deduced some plausible reason. So the first one includes a little bit of transportation, so in particular dealing with our blood. So the thought is that endometrial tissue is moved to other areas of the body through the blood or lymphatic system. Another cause for endometriosis is linked more to genetics. So researchers have thought that maybe certain genetic components or genes make someone more likely to get endometriosis. They still don't have the specifics regarding this, but they have a strong inclination that genetics plays a role. Next, we have something called reverse menstruation. So usually during the menstrual cycle, the endometrial tissue will leave the body. However, when it comes to endometriosis, it's thought that this endometrial tissue ends up going up to the fallopian tube and to the abdomen area. And then lastly, it's thought that cells can actually become endometrial cells and start growing outside of the designated areas. So again, these are all plausible reasons, and research is still kind of underway to determine exactly what is the main cause for endometriosis. We can go to the next slide. So according to the World Health Organization, endometriosis affects roughly 10% or 190 million reproductive aged women and girls globally. And right here in Canada, nearly 1 million Canadians are impacted by endometriosis. So its impact is definitely great. Go to the next slide. So when it comes to symptoms, there's a common misunderstanding that if a person has endometriosis, then they'll definitely be facing some of these symptoms, but that's not always the case. In fact, some people don't even face any symptoms at all. Yet, some of the most common symptoms that people do experience or might experience is pain in the pelvis region during periods or during or after sex, when urinating or defecating, and then some people just have and or experience chronic pelvic pain. We also have heavy bleeding during or between periods, infertility, bloating or nausea, fatigue, depression and anxiety, painful menstrual cramps, and then diarrhea or constipation during a menstrual period. So as you probably noticed, these symptoms overlap with several other health-related issues and conditions. So it's important that if you deal with any of these symptoms, that you first talk with your clinician or your family doctor so that they can get the ball going to see if you do have endometriosis or maybe there's something else underlying going on. And again, create that personalized prognosis for you. And the next slide. So in terms of treatment, we'll start off with painkillers. So a lot of individuals that deal with endometriosis deal again with those menstrual cramps or pelvic pain, and that's usually managed by over-the-counter medications like Advil and Tylenol. But in particular, when it comes to treating endometriosis, a lot of people will zero in on hormone therapy because the growth of the endometrial tissue is known to be dependent on various hormones. Hormone therapy can sometimes help slow the growth of the tissue and sometimes even prevent new tissue from forming. So first off, we have birth control, for example, which is in part used to help with pain, but also may help control the hormones involved in endometriosis. We also have something called gonadotropin releasing hormones, agonists and antagonists, which are responsible for lowering estrogen levels, which helps to block the menstrual cycle and overall allow for a shrinking of those endometrial tissues that are usually tied with pain. Next, we have progesterone therapy. So progesterone in particular is a form of another hormone called progesterone, and that plays a role in the menstrual cycle as well as pregnancy. Thus, the overall therapy can help to stop menstrual periods and the overall growth of endometrial tissue as well. Lastly, we have aromatase inhibitors. So these are a class of medications that lower the amount of estrogen in the body, which allows for, again, the slowing of that growth of that endometrial tissues. Now, for some severe cases, surgery can be used to remove the endometrial tissues that may be causing concern and/or organs that have been impacted. However, the last resort would be something such as a hysterectomy, which is a procedure to remove the uterus and sometimes the ovaries. And this will usually only occur when the pain is at intolerable high levels and no other form of treatment have been effective thus far. Then an elective hysterectomy may be advised, but it's usually few in terms of cases. Go to the next slide. So the last thing that I would like to touch on before we zero in on the heart impacts is the fact that Black women are 50% less likely to get diagnosed for endometriosis. And this is not attributed to the simple fact that minorities are less likely to get to the disease, but because of the lack of research and representation within data. So now as we delve deeper into the idea of how this disease can impact the heart, it's imperative that we highlight the need for more of an equitable health system servicing all at all levels in order to make sure that one's reproductive health is in check so that other components such as their heart health can also be in check, as we know that the body kind of works in tangent with one another.
Okay, so now we're going to talk more specifically about the relationship between endometriosis and its impact on the heart. Next slide. So first, I'm just going to do a quick overview of what heart disease is in relation to endometriosis. So both endometriosis and cardiac disease can be defined as diseases or disorders of inflammation, or a disease where inflammation is very apparent. Specifically, atherosclerotic cardiovascular disease is a disease of inflammation that is most commonly associated with endometriosis. And from that, other heart diseases can develop as it is a risk factor. For example, when looking at risk factors for coronary heart disease, inflammation is seen as the leading mechanism of vascular injury and atherosclerosis progression. Slide. So, for further association between heart disease and those diagnosed with endometriosis laparoscopically, here are some statistics about endometriosis and heart disease. So, there's a 52% increased risk of having a myocardial infarction, so a heart attack. There's a 91% increased risk of having angina, which is a type of chest pain due to decreased blood flow to the heart. There's a 35% increased risk of having to have a coronary artery bypass surgery or stent or coronary angioplasty. There's a 22% increased risk of hypercholesteremia, which is just high cholesterol, and a 29% increased risk of hypertension, which is high blood pressure. Similarly, we wanted to share some statistics about endometriosis and stroke. So studies found that there's a 34% increased risk of incident stroke for individuals diagnosed with endometriosis, both hemorrhagic and ischemic, and that younger women experience a higher incidence of stroke. So in general, it's found that endometriosis increases risk of three main categories of heart disease or associated heart disease, and that is, so it increases the risk of atherosclerosis through atherosclerotic cardiovascular disease, which is a risk factor in developing coronary heart disease, as mentioned before, and ischemic heart disease, hypertension and gestational hypertension, preeclampsia, and lastly, cerebral vascular disease, which includes ischemic stroke.
That's really interesting that you talk about is that so heart disease has been around for a long time, and we learned a lot about it. And the classical thinking of atherosclerosis or heart disease is you need to have LDL cholesterol, the bad cholesterol that circulates in the bloodstream, and it gets into the blood vessel wall and causes inflammation. And so we know that having high blood pressure, you smoke, having diabetes, family history, high LP little a, overweight, all injure. And you mentioned this association with inflammation. Inflammation is everywhere. So we're just going to pause for a second over here, and I'm going to actually treat my inflammation right now with some push-ups. So Amir, why don't you show us our, um, our YouTube page, or sorry, our website, and what myself can do is I'm just going to do a few little push-ups. I'm going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Holy boys. Ah. So, so we're doing some push-ups over here. So we're part of the push-up challenge, and so the push-up challenge is something that started the month of February, and so you're supposed to do 2,000 push-ups for the month of February. So I gotta just go to the app over here, and I've done some 70 already today, and I'm up to 90 over here. So I'm up to 90 of 153 today. And so I never thought I'd be doing 2,000 push-ups this month, but the reason one is for mental health. And so is that something you want to do? And the challenge is almost over, but it's been a lot of fun. And so if you go to our website, drcurnewhealth.com, you'll get different things that we're trying to do. And one of the things that I realize over and over again as we age, between the age of you guys in your 20s to people in their 60s and 70s, we can lose up to half our muscle mass. And the best way to decrease the rate of that from happening is exercise with resistance training. So I play squash, and tomorrow morning I'm playing squash at 5:45 in the morning time. I'm going to continue to do my push-ups. And Amir, I think I went skating again last night. I'm going to see it in the at the harbor, and it said closed, but there was myself and a couple of people skating there at +7 degrees, but it's all a nice ice rink there that refrigerated by the city of Hamilton, so it's very kind, and we'll see if it's open or not tonight. But you got to do these sorts of things. You have to have some fun. So um, the good thing is I'm not at risk for endometriosis, but I'm at risk for heart disease, and the best way to treat pain is with activity. So I always think about the forms of activity. Number one is just getting out to walking is a good thing to do. Number two is just getting some aerobic capacity and intensity. So getting to a higher intensity, it's important. So I'm going to play squash tomorrow. Number three is those weights, and so I'm lifting weights and I'm doing some push-ups and doing some bands. The next one is actually balance training. As we get older, we tend to fall. So these are things that are just good for any form of inflammation. So that was like a little pit stop there. So for people who suffer endometriosis, one way to treat their pain is to give you different type of pain. My muscles in my arms are aching. So we're gonna do another 10 more. Let's go do more push-ups again. We did a little bit more over here. So there we go. There we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Now, Darren, the guy I'm playing squash with tomorrow morning, he did his 2,000 push-ups in the first week. And one way of doing just push away from the fridge would be doing that 2,000 times would be a good thing too as well. So let's get away from the commercial, get some form of activity, and tell us more about endometriosis, and tell us about what else we can do. Thank you.
Of course. So first we're going to do kind of like the reasons why there's an increased risk, or like the relationship, why there is one. So one of them is going to be treatments such as having a hysterectomy, which is taking out the uterus, or an oophorectomy, which is taking out the ovaries, leads to premature menopause, which is a well-established risk factor for developing atherosclerotic cardiovascular disease, which is then again a risk factor in developing coronary heart disease and ischemic heart disease. So this is because it prematurely and abruptly halts the cardioprotective properties estrogen has on the cardiovascular system, which occurs when when you're not menopausal yet, when you're still having your periods. So this is because So estrogen is able to increase nitric oxide release in arterial endothelium, which helps with vasodilation, allowing for greater blood flow, amongst other things. And another treatment, such as taking non-steroidal anti-inflammatory drugs, was said to contribute to the relationship between cardiovascular disease and endometriosis, as it increases blood pressure. So that's what some studies found, was that it just increased blood pressure, which again, hypertension, and it all comes together with heart disease. So, and then another reason for increased risk is that people with endometriosis have an increase in inflammatory factors, an increase in oxidative stress while having a decreased amount of antioxidants, an increased serum level of low density lipoprotein while having a decreased serum level of high density lipoprotein, compared to women who are not diagnosed with endometriosis. These factors are connected with heart disease, such as atherosclerosis, through endometriosis having increased endothelial inflammation and activation alongside pro-inflammatory and so pro-inflammatory and inflammatory cytokines, chemokines, and growth factors, which are all just various forms of inflammatory factors, which are also found in atherosclerotic plaque. So this all results in an increase in developing microvascular dysfunction, which can lead to the development of atherosclerosis, as women with endometriosis also have an increased serum level of low-density lipoprotein, which is known as bad cholesterol, and a decrease in serum level of high-density lipoprotein, which is good cholesterol. So it all kind of comes together to show how these factors lead to an increased risk in hypercholesteremia, which is again high cholesterol, and hypertension, which are all in themselves factors in developing heart disease. Additionally, this isn't like directly mentioned in the slide, but it was also found that premenopausal women diagnosed with endometriosis had an increased arterial stiffness, which is an early marker that there are changes occurring in the arterial wall, becoming a risk factor for developing cardiovascular disease. So then you can see again with the high serum levels of low-density lipoprotein, how it all comes together to have an increased risk in developing coronary heart disease. So, and then one of the last main reasons that endometriosis leads to increased risk of developing heart disease or stroke, as both these pathways are very similar, is that there were actually genetic variants in both atherosclerotic phenotypes and endometriosis development, meaning that both coronary heart disease and endometriosis share common genetic susceptibilities through genome-wide association. So they both have an antisense encoding RNA in the INK4 locus on chromosome 9p21, which is pretty much just associated with apoptosis, cell proliferation, and adhesion, which are all associated with the formation of atherosclerotic plaque that leads to coronary heart disease, as well as the genetic similarity is also found associated with intracranial aneurysms, stroke, diabetes, abdominal aortic aneurysms, and peripheral vascular disease. So the potential treatments that we found in research was mostly medication. So one of them is metformin. And metformin contains anti-inflammatory properties, which can possibly reduce serum cytokines and therefore reduce systemic inflammation, as well as inhibiting endometriosis development. And so that would also inhibit the associated characteristics such as inflammation and all the other characteristic profile of endometriosis that I mentioned beforehand. Another possible treatment would be prescribing statins and other cholesterol-reducing agents, as their goal is to reduce low-density lipoprotein cholesterol, known as, again, bad cholesterol, which is a great risk factor in developing the coronary heart disease. And women with endometriosis and serum levels have a higher level of low-density lipoprotein, so you can see how they'd be able to lower that risk factor that is associated with endometriosis. And then lastly, a potential treatment would be prescribing hormone replacement therapy as one of the main treatment plans for endometriosis. Well, not the main treatment plan, but a treatment plan for endometriosis is having a hysterectomy, which would lower down the natural production of estrogen, which again has the cardioprotective properties that women who are not menopausal have. And so, however, for this specific treatment, it would only be beneficial when taking early after menopause and for early arthrogenesis, since in that kind of like in that age, not age range, but like that kind of period of time when you're still early in menopause, it shows that there's a reduced risk of having a heart attack or heart failure. However, if it's given later, there's actually studies showed that that was actually potentially harmful by increasing overall total mortality. So with that specific potential treatment, it would have to be done, I think it was like 5 years after menopause started, or if it was still early arthrogenesis.
It's very interesting about hormone replacement therapy because women usually have heart disease 10 years later than men. And one of the thoughts that estrogen is a vasodilator, it may have protective effects. But we know that clearly we have a series of two large randomized controlled trials, the Women's Health Initiative and the HERS trial, that showed that hormone therapy 10 years or so after the menopause or later actually is directly causes blood clots, causes strokes, and causes increased risk of heart attacks. Now, around the time of menopause, to me, the data is not as well known because we haven't done the proper trials. So some people believe that hormones around the menopause are potentially safer or safe. I really don't know. I'm stuck at that area. So as when I think there's smoke, there's fire. So right now is that hormone replacement therapy well past the menopause. It's good for the bones. It's bad for breast cancer. It's bad for heart disease. It's bad for stroke. It's bad for blood clot. Um, Whether or not it would be safe close to the menopause, I still think we need more proof in that area. So I'm not as secure as you are in that statement yet, but it's been said by but some people. There's a division about that, and hopefully we'll have better trials in that area as time goes on because I don't think we have enough pure data about this. It comes into testosterone therapy as well for both males and females. Is that testosterone? I'm trying to build muscle. I'm going to still build muscle with exercise resistance training. Whether or not I would do better with testosterone as males get older, they lose testosterone. Um, I'm worried about testosterone therapy. We don't have good data about this, so I'm afraid to use hormones unless you're really truly deficient. Um, More to learn about this, and I've learned a lot about endometriosis today. And tell us more.
Yeah, just absolutely. I feel like there are not enough trials that have very competent data for any of the potential treatments. And most of the most of the research I looked at definitely like lean towards the metformin or the statins just because it has a more direct relationship to the characteristics of endometriosis and its connection to heart disease. But absolutely, I just felt like it was important to add how hormone replacement therapy differs depending on when you want it to be prescribed after menopause. So this is just a quick summary to show the relationship between endometriosis and heart disease. And it's just endometriosis characterized by inflammation, endothelial dysfunction, increased oxidative stress, arthrogenetic lipid profile, which is the high serum levels of low density lipoprotein and low serum levels of high density lipoprotein, and increased oxidative stress, which are all risk factors associated with cardiovascular disease as well. Thank you for listening.
That was fantastic. So, one of the things first of all, endometriosis can be a great masquerader. People can say their pain is something else, but one of the causes. If you can go with that initial slide about what endometriosis presents with. So look at some of the symptoms that you can see. We'll get to that slide there. So heavy periods, painful periods, cramps, difficulty having become pregnant, depression, fatigue, pelvic pain, bloating, nausea. These are all very non-specific findings, and they can be explained by lots of things. But one of the causes, as you mentioned, is endometriosis. And just go back one slide about the pathophysiology of endometriosis. Um, Again, it's abnormal tissue outside the normal reproductive area, and that being the wrong place, it can lead to these problems. And what I've learned over time is that certain diseases early in life can lead to heart disease later in life. So if a woman gets pregnant and she has hypertension during her pregnancy, that's a marker for future high blood pressure and future heart disease and stroke. If a woman has gestational diabetes, got diabetic during pregnancy, it goes away after um, the pregnancy, but that woman is at much higher risk for heart disease and stroke later in life and for future diabetes as well. What you taught me today, which I did not know, that if you have endometriosis, it puts you for higher risk for heart disease and stroke as well. So thank you for sharing that and something to think about. Amir, what did you learn from all this?
I'll just repeat that. Endometriosis can affect the heart through ways that are we see commonly um, in normal presentation of heart disease, and we heard about inflammation and saw Dr. Curnew take steps to decrease inflammation with his push-ups there, and we are a little coming to the end of that push-up challenge, but if you're still interested in signing up, you just head over to drcurnewhealth.com, and you can click the register now button and follow through, and we see Dr. Curnew going in to do more push-ups and decrease the inflammation some more. Yeah, that's
6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, I'll stop over here. So I want to, if we get back to the presentation, that let's have some fun. And exercise is certainly a good thing. I want to thank the crew today for putting on such a wonderful presentation, a topic that I know very little bit about. And I'm certainly now on the radar screen, and just find ways to learn and be curious. So I thank you for sharing that. Uh, does anybody have any final thoughts that they want to share with us? So we'll just end over here that endometriosis can be a problem. It and there are therapies for that, and it also has an association with other disease processes such as heart disease and stroke, which I didn't know about. And so I'm going to encourage you to keep learning. And I thank the team for putting this together, and I wish everybody a great night. Good night, everybody.